Welcome back to the Deep Dive. We often talk about the big breakthroughs, right? The new therapies, the things that make headlines. But today, we're actually going behind the scenes a bit. We're looking at something that maybe doesn't get the spotlight, but is, well, absolutely crucial. It's a key piece of the puzzle, really, that often decides if those big discoveries even happen. We're diving into something called the Research Spray Add-on Kit. Sounds simple, maybe, but it's having a pretty big impact on peptide research. Now, this kit, it isn't about one specific new peptide. It's more about how we study all peptides, how we unlock their potential. It's basically two parts, a special reconstitution solution and a very precise spray bottle. And it's specifically designed for nasal studies. Now, you might be thinking, nasal delivery, why is that such a big deal? Well, it turns out it's becoming a really, really important research area in peptide studies. And we're going to dig into exactly why. Okay, let's unpack this. And to help us navigate this complex world of research tools, I'm really thrilled to have an expert with us today. Dr. Collins is renowned in peptide research, especially delivery systems. It's wonderful to have you here.
Thank you. It's great to be here. And I really appreciate how you framed that. Because you're right, delivery systems, how we actually get these amazing molecules where they need to go in a research setting, they often get overlooked. People focus on the molecule itself, naturally. But honestly, the delivery method is just as vital, sometimes maybe even more vital. You need it to get reliable, meaningful data. Without the right delivery, even the most promising peptide can just, well, fall flat in the lab. It won't show its true potential.
That's a really powerful point to start with, something I think a lot of us, maybe even researchers sometimes, don't fully appreciate. So when scientists are working with peptides, they've got options for how to study them, right? It's not just one way. We hear about giving them orally or injections, skin patches.
Yeah.
And now, nasal delivery seems to be gaining traction. Could you maybe break down why the delivery method itself makes such a huge difference in the study results? It feels like it should be simpler.
It really does feel like it should be simpler, but biology, well, it's complex. Choosing the route of administration is, I'd say, one of the most critical decisions. It fundamentally dictates how that peptide molecule interacts with the biological system being studied. Peptides are fascinating, but they're also quite delicate. They're chains of amino acids, as you know, and their integrity, their structure, and their bioavailability, which just means how much active peptide actually gets to the target, is super sensitive to the environment it goes through. So each delivery method presents its own set of challenges, its own physiological hurdles, but also its own opportunities. Pick the wrong route, and the peptide might never even reach its destination. Or, maybe worse, it gets there, but it's degraded, inactive. And that leads to results that are completely misleading.
Right. That difference between just getting there and getting there active and ready to work. That makes total sense. So let's maybe walk through some of those traditional ways researchers have studied peptides for years and the specific problems they face, especially with these sensitive molecules. Maybe start with the one that seems easiest from a user's point of view, taking something orally.
Oral delivery, yes, it's conceptually simple. And obviously, it's the most convenient if you're thinking long-term about potential therapies. We take pills all the time. But for peptides, especially in research, it's riddled with challenges. The main one is just the incredibly harsh environment of the GI tract, the stomach, and intestines. Peptides are usually very vulnerable to being broken down by enzymes. Our digestive enzymes, proteases, they're designed to chop up proteins and peptides in our food. And the body doesn't really know the difference between lunch and a complex research peptide, you see. It just sees a protein chain to dismantle.
Wow. So even if a researcher makes this brilliant peptide, theoretically amazing, if they try to study it orally, the digestive system might just shred it before it can do anything. That must be incredibly frustrating from a research standpoint.
It absolutely is. It's like sending a very delicate, specific message through a really aggressive postal service. One that rips up most letters before they even get delivered. Maybe a tiny fraction gets through, but you can't rely on the message being intact or even know consistently how much arrives. This unreliability makes getting consistent, reproducible data incredibly difficult. And reproducibility, well, that's the bedrock of good science. And then there's another hurdle, first-pass metabolism. Even if some peptide survives the gut, it goes straight to the liver. And the liver is another major site for breaking things down. It can further degrade or modify the peptide before it even gets into the general circulation in an active state. So yeah, it adds another layer of unpredictability.
Okay, so navigating the gut and liver is like running a serious gauntlet for peptides. Then you have injections. That feels like the most direct approach, right? Yeah. Bypassing all that internal stuff. What are the pros and cons there? It almost sounds ideal in comparison.
Injections like subcutaneous under the skin or intravenous right into a vein, they definitely offer a big advantage in effectiveness and direct access. You completely bypass the digestive system and that first pass liver effect. You deliver the peptides straight into the bloodstream or nearby tissues. So you get much higher bioavailability, more predictable pharmacokinetics, meaning you have a much better idea of how much peptide is getting to the target, how long it stays active. That directness is really valuable for figuring out basic things like dose-response relationships.
Yeah, injections definitely seem to solve those gut issues. Actually, if you want direct delivery, high bioavailability, why even look at anything else? I mean, besides the obvious, needles aren't pleasant, does injection ever complicate the research itself?
That's a really good question. And yes, it absolutely can. While it's direct and effective, injection is invasive by nature. In a lab setting, that means careful handling. Sterile techniques are essential. It can get quite complex, especially if you're doing long-term studies or working with sensitive animal models. Repeated injections can cause problems like tissue damage, inflammation, or even just stress the animal out. And that stress response itself could potentially mess with your experimental results, right? Confound the data. So ethically and even practically for animal welfare, repeated injections aren't always the best choice. Plus, for some peptides, maybe a super rapid spike in concentration from an IV isn't what you want. It could cause off-target effects that hide the specific biological activity you're trying to isolate. So yeah, it's direct, but it's also demanding to execute properly and can introduce its own variables if you're not extremely careful.
Direct but demanding. Yeah, that captures it well. Okay, and the last one we mentioned, transdermal. Through the skin, like patches or creams. How does that work for peptides? Seems non-invasive, appealing.
Transdermal delivery, yes, absorbing things to the skin. It definitely has that non-invasive advantage. Think about nicotine patches, hormone patches, those are common examples. Can give a nice sustained release sometimes. But for peptides, it's often pretty limited. The skin is just an amazing barrier. It evolved to keep things out, germs, toxins, and yes, foreign molecules. Smaller molecules, especially ones that, like fats, can sometimes get through. But larger peptide molecules, they really struggle to cross the skin's lipid layers in amounts that are actually effective for research. So absorption through the skin just isn't reliable or efficient enough for many peptides, especially if you need precise dosing or, rapid action. It has its own major limitations.
Okay, so given all these challenges with the traditional routes, the gut breakdown, the invasiveness of needles, the skin barrier, it really sounds like researchers are always searching for better, maybe more subtle ways to deliver these important molecules. Which brings us back to nasal delivery. Why has it gained so much attention? What makes it stand out as such a promising alternative, almost like a sweet spot?
Yeah, this is where it gets really interesting. Nasal delivery manages to hit a kind of sweet spot, balancing several key advantages. First, it's non-invasive, no needles. That simplifies experiments, makes it less stressful for research subjects, whether animals or, thinking ahead, potentially humans. It's also pretty simple to administer, almost like using a regular nasal spray for a cold. But the key is the nasal mucosa, the lining inside your nose. It's not just packed with blood vessels, it also has a surprisingly thin barrier. Combine that with a large surface area and often less enzyme activity than the gut, and you've got a really efficient gateway for molecules like peptides to get into the bloodstream directly and quickly. So you're essentially bypassing the harsh gut and the hassle and invasiveness of injections.
So basically, nasal sprays give scientists a way to test peptides without dealing with the digestive system or needles, offering a quicker, cleaner path.
That's exactly it. It's like finding an express lane.
Yeah.
A shortcut that avoids some of the biggest obstacles that make peptide research complicated or expensive with other methods. This efficiency lets researchers get straight to their main questions more directly, ideally with less interference from the delivery method itself. It really does strike a nice balance between being easy to use, non-invasive, and scientifically efficient. And that's gold in peptide research today.
Okay, that makes the appeal of nasal delivery really clear. But if it's such a great route, how do researchers actually use it reliably in the lab? You need control, precision, consistency, right? That's where this research spray add-on kit comes in, I assume.
Precisely. The research spray add-on kit is engineered specifically to optimize this nasal route. It tackles that critical need for precision and consistency head-on. It's not just a random spray bottle and some liquid. It's a system designed to address two crucial steps in working with peptides for nasal studies. It helps turn the theoretical benefits of nasal delivery into practical, repeatable lab work.
Okay, let's break down those components then, starting with the reconstitution solution. What is that exactly, and why is it so vital for getting a peptide ready?
Right, the reconstitution solution. It's a specially formulated solvent. Its main job is to dissolve the lyophilized, that's freeze-dried peptide powder, into a stable liquid form that's ready for research. Now, this might sound like a simple step, just adding liquid to powder, but it's absolutely fundamental. It's a make or break point for any peptide study. Peptides, especially when dry, can be unstable. They need to be dissolved in a very specific solution, one that not only makes them liquid, but crucially, maintains their chemical structure, their integrity, and their biological activity. This involves controlling things like pH, the salt concentration, tonicity, and preventing the peptides from clumping together or oxidizing.
So it's definitely not just adding water or standard saline solution. The specific formula of the solution actually matters a lot for the peptide's performance.
Oh, absolutely. Using the wrong solvent, or even just plain water, can cause the peptide to degrade quickly, lose its shape, clump up, or just behave erratically. If it degrades, well, it's useless, just broken amino acid bits. If it behaves inconsistently, your results are variable, unreliable, basically meaningless. Imagine trying to run an experiment where your main ingredient keeps changing. The data would be garbage. This solution is designed specifically to keep the peptide stable, ensuring that what you think you're studying is actually what you are studying. It prepares it for consistent active use. Think of it as the perfect liquid to gently wake up the peptide and keep it in top condition for its research mission.
Okay, so the peptide is properly dissolved and stable thanks to the solution. Now it needs to be delivered precisely. That's where the spray bottle part of the kit comes in, right?
Yeah.
Providing that consistency.
Exactly. The spray bottle might look like a simple device, but it's engineered for consistent, measured, and repeatable application. In research, you absolutely need to know that every single spray delivers the exact same amount of peptide in the same way every single time. This consistency isn't just nice to have, it's the absolute foundation of reproducible research. Even tiny differences in how the spray comes out, the droplet size, the volume per spray, the pattern, can cause big variations in how much peptide gets absorbed. And that variability in absorption directly affects your experimental data. It can hide a real effect, or worse, make you think you see an effect that isn't actually there.
So if one spray gives a bit more or less than the next or sprays unevenly, it could totally throw off the results and lead you down the wrong path.
Completely. Think about it. You're trying to see what effect a specific dose of peptide has. But if that dose changes with every spray, how can you trust your conclusions? Consistency in application removes those extra variables. It lets researchers confidently say, okay, the effect we're seeing is due to the peptide itself, not due to sloppy delivery. This precision allows for accurate dose-response studies, reliable comparisons between groups. It's critical. Every spray counts, as you said earlier. And this bottle is designed to make sure each spray counts reliably, delivering a consistent, measurable dose.
So this kit sounds like it really helps standardize things, not just in one experiment, but maybe across different experiments or even different labs doing similar work.
That's exactly the power of it. Consistency is, well, it's everything in good research. And this kit is built around that principle. It helps standardize the conditions for preparing and delivering the peptide. By providing that stable, pre-formulated solvent and a controlled spray mechanism, it gives labs a much more reliable starting point. This cuts down significantly on common mistakes, like using the wrong solvent, which ruins the peptide, or spraying inconsistently, which ruins the data. That level of standardization is huge for reproducibility. It makes research findings more trustworthy, easier to compare across different studies, and ultimately more impactful. It reduces the noise and lets the scientific signal come through more clearly.
Okay, we've established how vital consistency is and how this kit helps achieve it. But even with the best tools, things can go wrong, right? Researchers are human. Let's talk about mistakes for a second. What are some common pitfalls people run into, especially maybe newer researchers, when handling these tricky peptides and delivery systems?
That's a really important topic because even small errors can have huge consequences for the validity of the research and honestly just waste a lot of time and money. Meticulous preparation isn't just good practice, it's absolutely essential for reliable science. I often use an analogy like baking. Think about baking a complex cake. If you don't measure your ingredients precisely, or you grab the wrong kind of flour or baking soda, well, the cake just won't turn out right, no matter how good the recipe is or how skilled you are. You need that solid, precise foundation. It's exactly the same in the lab.
That's a great analogy. Makes perfect sense. So what are some of those key best practices researchers absolutely need to follow when handling peptides, especially for nasal delivery?
Okay, number one, using the correct solvent for reconstitution. We touched on this, but it bears repeating. Peptides are sensitive. The wrong solution can destabilize them, degrade them, make them clump, kill their activity. So using the provided appropriate solution is step one. Number two, avoiding contamination. This is critical. Even tiny impurities from dirty glassware, non-sterile equipment, even airborne dust can mess up results by interfering with the peptide or the biological system you're testing. Sterility is key throughout the process.
Yeah, I can see how easily contamination could happen in a busy lab. What about after it's reconstituted? How do you keep it safe then?
That brings us to number three, proper storage. Temperature, light, the container type, these all massively affect peptide stability. Leave a reconstituted peptide out on the bench, expose it to light, store it in the wrong kind of plastic, and it can degrade really fast, sometimes in hours or days. And tied into storage is a very common, simple mistake. Failing to properly label everything. Date of reconstitution, exact concentration, the peptide ID. Forgetting to label clearly leads to mix-ups, confusion, especially in shared labs, and can totally compromise data if someone uses an old or wrong solution without realizing it. And finally, consistent measurement is crucial at every step. Precision in drawing up solutions, precision in spraying, ensures the intended dose is the administered dose.
Okay, those are the ideals. But what are the mistakes people actually make, the common traps, even when they're trying to be careful?
Right. Beyond those general points, some specific errors pop up a lot. Improper dilution is a big one. Using too much or too little solvent when reconstituting, that directly messes up the final peptide concentration, meaning the dose you give is wrong, maybe way off. With nasal spray specifically, inconsistent spray use is common. People sometimes forget to prime the bottle. That means giving a few sprays into the air first, before the actual dose, just to make sure the pump is fully loaded and delivering the right amount from the very first spray. If you don't prime, especially if the bottle's been sitting, those first sprays might be partial, or just air throwing off your dose right at the start.
Priming just a few sprays into the air to get it going consistently right. Seems simple but easy to forget.
Exactly. Simple, often overlooked, but vital for consistency, especially if every single dose needs to be exact. Another really common but easily fixed mistake is poor labeling. In a busy lab, it's tempting to skip writing the full date concentration notes, but that leads to chaos later. Using an unknown solution, that compromises everything. And of course, bad storage. Letting reconstituted peptides sit around too long without proper refrigeration or freezing, whatever is needed for that specific peptide. Degradation is inevitable then. These seemingly small things can completely undermine weeks or months of hard work, leading to results you can't repeat, or worse, drawing the wrong conclusions. I remember early in my career, before standardized kits like this were common, the sheer frustration of getting inconsistent results. Was it the peptide? Was it my prep? You spend so much time troubleshooting the basics.
Sounds incredibly frustrating, like you're chasing ghosts, as you said. So this kit then, it acts like a safety net against a lot of those common errors. It helps keep researchers on track with best practices.
That's a really good way to put it, yes. A safety net. The Research Spray add-on kit directly supports these best practices and minimizes many of these risks. By giving you the right, stable solution and a reliable, consistent sprayer, it takes a lot of the guesswork out, reduces the chance for human error significantly. It helps scientists kind of bypass those basic technical headaches so they can focus their brain power and time on the actual research, the biological questions, analyzing the data, generating insights instead of constantly troubleshooting whether their peptide was prepared correctly or delivered consistently. It streamlines the whole process, making solid research more efficient and accessible.
Okay, it's really clear how this kit helps with the how of research, avoiding those lab pitfalls. But let's zoom out again for a minute. Beyond just making lab work easier, what are the bigger picture strategic reasons why nasal delivery is such a hot topic right now? Why are scientists so interested in this route?
Right, this is where the excitement really builds. Nasal delivery offers several strategic advantages that are genuinely opening up new possibilities in peptide research, potentially speeding up discovery in ways that were difficult before. First, there's the rapid absorption we talked about. That nasal lining, the mucosa, is super permeable and has a rich blood supply. This anatomy means peptides can often get absorbed into the bloodstream much faster and more consistently than other non-invasive routes. This speed is really important if you're studying peptides that break down quickly in the body, or if you need to see an effect happen fast for your experiment, like in behavioral studies or testing rapid drug effects.
So it gets the peptide into the system much quicker, which is key for certain types of experiments.
Precisely. That speed can be a real game changer, giving you insights in real time that slower methods might miss. Second, the non-invasiveness is a huge plus. Not just practically, but ethically too. No needle simplifies procedures, reduces stress and discomfort for lab animals, which isn't just the right thing to do, it's also good science because stress can affect physiology and behavior, messing with your data. It also makes the approach potentially more translatable to human studies down the line. It's just a gentler, more user-friendly method that can yield cleaner data.
And you mentioned something really intriguing earlier about possible direct routes to the brain, the central nervous system.
Yeah.
Can you elaborate on that? That sounds potentially revolutionary for neuroscience research.
Yes, this is probably one of the most exciting aspects and a huge driver of the current interest. There's strong evidence suggesting a potential for a more direct pathway from the nasal cavity to the brain, essentially bypassing the blood-brain barrier. You see, the nasal cavity is anatomically very close to the brain, and it seems some molecules, especially peptides, might be able to travel along specific nerve pathways. Primarily the olfactory nerve, the one involved in smell, and the trigeminal nerve, which handles sensation in the face.
Wait, so the smell nerve and the facial sensation nerve could act like direct highways for peptides straight into the brain. That's wild.
It is pretty amazing. The olfactory nerve endings extend directly from the nasal lining into the olfactory bulb in the brain. That's a direct neural connection. The trigeminal nerve also has extensive endings in the nasal cavity, offering another potential fast track. This unique anatomy might allow peptides administered nasally to reach brain tissue more directly and efficiently than if they had to circulate through the blood and try to cross the very selective blood-brain barrier.
Wow, so it genuinely opens doors that other methods just can't.
Yeah.
Could you maybe give an example? Like, what kind of brain research question was super hard before, but nasal delivery makes feasible now, maybe in areas like Alzheimer's or anxiety?
Great examples. Okay, take Alzheimer's research. Let's say you have a peptide designed to target amyloid plaques or tau tangles in the brain. Traditionally, getting it there meant maybe invasive injections directly into the brain, highly complex, risky, not practical for long studies. Oral wouldn't work. But with nasal delivery, researchers can now administer these peptides non-invasively, potentially getting them directly to brain targets. This allows for repeated dosing over long periods in animal models with far less stress and intervention. That's huge for studying chronic disease progression and treatment, or for anxiety research studying neuropeptides involved in stress or mood. Nasal delivery could allow for rapid brain exposure. Researchers could then observe immediate behavioral changes, potentially linking them to specific neural circuits, without the confounding effects of systemic drug distribution or the stress of an injection. It makes asking certain questions about brain function and dysfunction much more practical, less invasive, and potentially yields clearer answers. It doesn't replace other methods, but it adds a vital tool, especially for CNS work. It's like that dedicated express lane we talked about,
Yeah.
accelerating discovery in neuroscience.
I really liked your earlier point that the tools can be just as important as the peptides themselves. Could you expand on that a bit more? How these kits and tools aren't just extras, but actual enablers of discovery?
Absolutely. It's something I feel quite strongly about because it's so fundamental yet often overlooked. Imagine a researcher has developed this incredible peptide. Maybe it has amazing potential for treating, say, diabetes or an autoimmune disease. Years of work went into designing and making it. But then when they go to test it in an experiment, their delivery method is inconsistent. Maybe the peptide degrades in the solution before it's even administered, or the dose varies wildly each time. What happens? The true potential, the real behavior of that fascinating peptide gets lost in the noise. The data is messy, unreliable, maybe even suggests the peptide doesn't work or works erratically, leading to false conclusions, missed opportunities.
So you could have a potential game-changer molecule, but without the right tools to study it properly, that breakthrough might never actually happen in a real reproducible way. It just stays as theory.
Precisely that. The right tools, the correctly formulated solvents, the consistent sprayers, the proper storage, they're the unsung heroes. They don't do the science, but they create the necessary conditions for good science. They ensure the peptide is tested in a way that produces meaningful, reliable, repeatable results. Without them, valuable insights get lost, or worse, wrong conclusions get published. Researchers might give up on a promising peptide just because their delivery method failed them. The tool isn't just an accessory, it's a critical part of the discovery engine. It turns potential into verifiable scientific fact.
So at the end of the day, good science just needs good tools. And this research spray add-on kit sounds like a perfect example of that principle.
It really is. It's a tangible example of how a relatively simple but well-designed tool can significantly boost the quality of research. It provides the consistency and reliability needed to move past technical hurdles and focus on the real scientific questions. In many ways, tools like this, enabling nasal delivery, act as a kind of bridge technology. They lower the technical barriers and costs, making it easier to explore complex questions that might have been too difficult or expensive with only older methods. Things like subtle effects on brain receptors, specific behavioral changes, intricate metabolic pathways. These can be studied with more control and confidence using consistent nasal delivery. It helps democratize cutting edge research.
You've made a strong case for its value in active research. What about education? Do you see kits like this being useful for students or new researchers just starting out in peptide work? It seems like a complex field to enter.
Oh, absolutely. From an educational perspective, these kits are fantastic. Think about all the technical details of handling peptides: which solvent to use, how to reconstitute properly, the right storage, understanding different delivery methods. It can be really overwhelming for students or someone new to the lab. There's a definite learning curve, and a lot of early struggles are often around mastering these basic practical skills. Kits like this really help lower the barrier to entry. They offer a standardized, straightforward way to learn these critical aspects in a controlled manner.
So instead getting bogged down trying to figure out the perfect solvent mix from scratch or wrestling with inconsistent spraying, they can focus on the why and apply the techniques more easily.
Exactly. It becomes a great teaching resource. Instructors can use it to demonstrate delivery routes practically, teach best practices for handling sensitive molecules, and really hammer home the importance of reproducibility right from the start. Students get hands-on experience seeing how precision in preparation and delivery directly impacts their results. It helps build those crucial good lab habits early on.
So it's practical for experienced labs, but also a really valuable teaching tool for training the next generation.
Precisely. It bridges that gap between textbook theory and actual hands-on lab work. Concepts like peptide stability or bioavailability become less abstract when students are actually doing the steps and seeing the importance of doing them correctly. It makes learning more engaging, more effective, and builds a stronger practical foundation for tackling more complex research later. It ensures they understand methodical, reproducible science is key.
That's really insightful thinking about the whole research life cycle. Looking ahead then, with this push towards more precision and standardization, do you expect we'll see even more advanced tools like this kit coming out?
I absolutely do. I think we're seeing an ongoing, probably accelerating evolution in lab tools. The research spray add-on kit is a significant step, but it's part of a larger trend. We can definitely anticipate more innovation. For example, new types of reconstitution solvents might be developed, designed for even greater peptide stability, maybe allowing longer storage or use with trickier peptides. We'll also likely see improvements in the spray devices themselves, maybe offering even finer control over droplet size, spray patterns, dosing accuracy, perhaps even with electronic feedback.
What about bringing in more digital tech? Automation.
Mm.
Seems like a natural fit.
Oh, definitely. That's a huge area. Imagine digital tracking built into these systems. A device that logs every single spray when it happened, the exact volume, maybe even monitors the storage conditions of the peptide solution, like temperature and light exposure over time. That kind of data login would massively boost accuracy, traceability, and reproducibility. And yes, automation will likely play a bigger role too, streamlining reconstitution, maybe even delivery in some settings, to minimize human error, increase how much work can be done, and free up researchers for more complex analysis.
So this kit is really part of a bigger movement towards, well, smarter, more precise, more efficient lab work. A stepping stone, not the final word.
That's exactly how I see it. It's a clear step towards making peptide research more reproducible, more accessible, and ultimately more efficient. It represents that move towards the next generation of lab tools where ease of use meets high precision. This focus on better tools ensures that the amazing discoveries being made at the molecular level can actually be studied reliably and confidently, leading to faster, more solid breakthroughs.
That's a really exciting vision for the future of lab tools. But, science is always evolving. There are always unknowns. While this approach and these tools are promising, I imagine the whole field of nasal peptide delivery is still developing. There must be questions still being worked out.
Absolutely, that's a critical point. It's vital to maintain that perspective. While tools like the Research Spray Add-on Kit are big steps forward, the science of nasal peptide delivery itself is definitely still evolving. This isn't a solved problem. It's more like we've been given a powerful new starting block, but there's still a lot of track ahead to explore and understand fully. It's a very active research area.
So even with better tools making the process more reliable, there are still fundamental questions about the underlying science that need more investigation.
Precisely. There are several key areas where more research is really needed. For instance, we need more studies to fully grasp the variability in absorption through the nasal route. While it can be rapid and consistent for many peptides, how much gets absorbed can still vary based on individual factors, maybe nasal airflow, mucus levels, even having a cold. It can also depend heavily on the specific peptide's properties, its size, charge, etc., and maybe even environmental factors. Understanding and controlling for this variability is crucial for accurate dosing, getting reproducible results across different studies, and eventually translating findings reliably, maybe towards clinical use. We need to pin down those variables better.
And what about how long these peptides stay stable once they're mixed in the solution for spraying? That seems important for longer experiments.
Yes, that's another key area. Long-term stability in these nasal formulations. The solution in the kit is designed for stability during typical research use, but different peptides naturally degrade at different rates. So knowing exactly how long various peptides remain potent and active in that ready-to-spray liquid form under different storage conditions is vital for planning experiments, especially longer ones, and certainly for any future thoughts about shelf life. Also, we need more research on how different types of peptides behave with this method. How do large peptides compare to small ones? How does charge affect absorption through the nasal lining? Are some peptides broken down by enzymes present in the nose? Each class of peptide might need slightly different approaches or considerations for optimal nasal delivery. So, more specific studies are needed for different peptide families. So, yes, while the kit standardizes the process, the fundamental science of how peptides interact with nasal environment is still a really rich area for ongoing research. And that continued research will only make tools like this even more effective and broadly applicable in the future. Hashtag outro.
Well, this has been incredibly insightful. We're nearing the end of our deep dives today. But here's something to really think about. Before we wrap up, I want to leave you, our listeners, with this thought. Peptide research isn't just about the molecules themselves, those amazing little protein chains doing incredible things in biology. It's also fundamentally about the tools, the methods, the precision, all the things that make discovering and understanding those molecules even possible in a reliable, repeatable way. What stands out to you about how these often unsung tools actually shape our scientific understanding and push things forward?
That's a perfect way to frame it, and I absolutely agree. The Research Spray add-on kit is, I think, a fantastic illustration of that very principle in action. It shows how a seemingly straightforward improvement in a tool can ripple outwards, enabling more consistent, more reliable, more innovative research, which ultimately deepens our knowledge of peptides and their vast potential.
This has been absolutely fascinating. Thank you so much for sharing your expertise and shedding light on this really crucial but maybe less visible aspect of peptide science. This has been incredibly valuable.
Thank you for having me. It was a real pleasure to discuss it, and I hope your listeners found it interesting and informative.
And to all of you listening, thank you, as always, for joining us on the Deep Dive. The big takeaway today, the Research Spray add-on kit is more than just convenient. It's a practical, educational, and innovative tool helping labs everywhere make their peptide studies more consistent, reliable, and accessible. It's one of those key enablers behind the breakthroughs. Now, before we sign off, just a necessary reminder. The mentioned products and peptides are not intended to refer to any peptides or products sold by Power Peptides. Products sold are strictly for research purposes and not intended for human consumption. So what does this all mean for you? Well, it highlights that understanding the how, the tools and methods behind the science is often just as vital as understanding the what. It's the precision tools that unlock reliable knowledge. Take care. Make sure you subscribe to the Deep Dive so you don't miss our next exploration, and we'll see you next time.